Well, many of us do have questions on who should be screened and what options are best. Yes, we're talking about colorectal cancer. Let's welcome Dr. Brian Caveney, Chief Medical Officer and President of Labcorp, here to raise awareness, including how the Count on You campaign aims to empower patients and continue that fight for health equity. So welcome to the show. Let's start with this. What are regular screenings for colorectal cancer? Why are they so vital? That's the key. Why are these screenings so vital?
Well, hi, Mike. Thanks so much. It's great to be with you. Now, unfortunately, millions of Americans are behind on their regular health care for their chronic conditions and their cancer screenings because of the pandemic. This happens to be Colorectal Cancer Awareness Month, so it's a great time to learn more about this condition and get screened if appropriate so that you can take care of this very preventable and treatable condition.
Yes. I tell you what, a lot of questions out there. Who should get screened for the disease and starting at what age?
Sure. Adults aged 45 to 75 of average risk who don't have any symptoms are who is typically targeted to get regular screenings. Now, anybody who has a very strong family history of colorectal cancer, or you have active bleeding in your stool, hemorrhoids, Crohn's disease, ulcerative colitis, talk to your doctor because you're likely to go directly to a diagnostic colonoscopy in that case. But if you're an average person from 45 to 75, then you are eligible to get regular colorectal cancer screenings.
And can you share details on an at-home test, these collection kits that are currently available to the public?
The great news is there is a variety of tools that you and your doctor can use to get screened for this very preventable condition. The ones that everybody knows, of course, colonoscopies, there are special kinds of CAT scans and other types of tests that your doctor can perform. But there's now a great host of different at-home stool collection kits that you can do in the privacy of your own bathroom in just a minute. To get all caught up on this particular screening. You just get a tiny a stool sample from your bowel movement, put it into a small container, mail it back to the laboratory, and within just a couple of days you'll find out whether that there was blood in your stool, and then you and your doctor can follow up appropriately, which in most cases means getting a diagnostic colonoscopy to look for polyps, adenomas, or other abnormal things in your colon that then the doctor can intervene on and take care of once they're doing the colonoscopy.
Yes, and what is the impact of early detection in a patient?
The great news is the science suggests that if adults get their regular colorectal cancer screenings, we can catch about 3 cases out of every 1,000 people. Now that may not sound like a large number, but if you multiply that by the hundreds of millions of Americans, we can have a real impact and save a tremendous number of lives just by getting these very simple regular screening tests.
Very good information, yes. So get those screenings done. It does make a huge difference. And where can viewers go for more information?
It's always a great idea to talk to your doctor about this and all of the other preventive services that might be right for you based on your age, sex, and other risk factors. Your health plan often has information about how you can get these tests at no cost to you from an in-network doctor or colonoscopy center. And you also can find out a lot more information about colorectal cancer and many, many other conditions from our website, which is labcorp.com/countonyou to learn more.
Thank you so much, Dr. Caveney. You know what? Let's continue to make that difference, get those screenings done, and of course, for much more on this, just head to our website, and that's firstcoastliving.net.